The Community Care Access Point helps older people and individuals with a disability to remain living in their own home for as long as possible by providing access to services to help them stay independent and undertake daily living tasks. The Community Care Access Point is a centralised access, information, assessment and referral gateway which simplifies access to a wide range of community care services, including transport, personal care, meals, assistance with housework, respite services and in-home modifications, all through a single telephone call. The Community Care Access Point conducts an assessment over the phone to determine a person's eligibility, care needs and priority for assistance, and then makes the appropriate referrals to service providers for support.
Well, basically we get a whole range of people calling us, from people with disabilities, their carers, and requiring a whole range of services, whether it's a one-off transport service because they need to get to a medical appointment, or whether it's ongoing personal care assistance or housework assistance, Meals on Wheels. So we assess for a whole range of services.
Every GP and practice nurse that I've gone out to and spoken to has usually said to me, wow, that's going to make such a difference in terms of the amount of time I have to spend on the phone. The fact that there is one service there that will do this should have been happening a long time ago.
I think Community Care Access Point is wonderful for clients because it means there's one single number that they ring where they can gain access to all the services that they need. They only provide their information once, but they do that sort of broad and shallow assessment and find out what the client wants, and then they make the referrals for them.
Probably the key for me has been there's a consistent assessment used. A lot of times when service providers would be assessing for people who are eligible for home and community care services, there was a little bit of a grey area. So now we're having a consistent assessment, and where we can guarantee that there's equitable access to home and community care services.
The evidence has actually shown that the over-the-phone model is actually quite an effective way of delivering a service. An assessment can be completed in the comfort of their own home.
At the Community Care Access Point, the assessors see that there is some complexity either in service provision or in those people's lives, and they'll refer to us for a caseworker to go out and work with those people.
So now they go directly to the Community Care Access Point, they have their assessment done, then it comes to us and it's already prioritised. So it really helps us in terms of that front-end assessment has already been done.
The thing that I believe is the most beneficial part of it is we can get on with our core business. I think an assessment these days is in the vicinity of 40 minutes. We've had 10 in this week, referrals. I would have to have somebody on here full-time for over a week to do those 10 assessments.
When referring a person to a service provider, the Community Care Access Point takes into account the person's choice of provider and any special requirements such as Aboriginality and cultural and linguistic diversity. They also consider the capacity of the service provider to accept the referral. Service providers should regularly advise the Community Care Access Point of their capacity to accept new referrals.
Okay, a client will call in during the initial phone call. They'll be asked on the phone if they're Aboriginal or Torres Strait Islander. They will then be referred to an Aboriginal assessor. We believe that we produce a culturally appropriate assessment with the clients.
Hopefully we can find them an Aboriginal service, but if not, we refer to mainstream. When they're referred to one of these services, I've come across them in the community, and they're very happy with what they're doing now. It got them out of the home and mixing socially with other Aboriginal people. And I've had some good feedback also from the service provider. By finding them extra clients who they didn't know before, I've made the referral.
The Community Care Access Point accepts referrals by email, phone, fax and HSNET, and uses HSNET to securely and efficiently refer individuals to the appropriate service providers.
The advantage to HSNET in working with Community Care Access Point is that The information is all on one form that can be electronically transferred so that we get all the information that has already been provided by the person to the access point. So there's not that duplication in question asking how many times you've got to ask somebody their name or date of birth.
So it's electronic, it's very secure transfer of client information. We receive that and it is electronically and immediately and wonderfully uploaded into our client management system. So there's no double entry. We don't have to sit there and keyboard in information which we had to do in the past. So it really streamlines that process for us.
Providers should monitor HSNET, acknowledge referrals within 3 working days, and respond whether the referral has been accepted or rejected within 10 working days thereafter. Providers should contact individuals within 5 working days of accepting the referral.
Once the assessment was done, it was sent to us, we just press the button, down it comes. Now that's how easy it is now.
We've been able to free up some caseworkers to get out there in the field working with people because we get that information from the community care access point. So it's certainly reduced that administrative role on filling in the documents because we get that information through HSNET.
When assessments come through from the community care access point and we need to clarify some information about the client or about the assessment that's been undertaken, our team leaders will simply ring the access point's team leaders. It's a really great collaborative relationship. What we're out for is a win-win on both sides, of course, and they're very helpful.
For us too, in providing services to people, it's about a consistent message, a consistent assessment as well. We get that with the community care access point. I think that's really provided some equity in access to services in our region.
Within our urban area, we've had 60% nearly of our practices start using Access Point. They've undergone the education process, have been receiving all of the referral information and those sorts of things.
Yeah, look, I've worked in the community care sector for a long time, and I think that the community care access point has brought us back into a situation where we can solve problems, make the system work better for people. That's really important for me because that's why we're here, to deliver services to people. So we are working things out, we talk to each other, the communication between service providers and the service system is better, and that only benefits the people out there receiving these services. So look, I think it's been really a good thing for us.
The Community Care Access Point is a joint venture between the New South Wales and Commonwealth governments. We are very grateful to the people in this video who let us into their lives to share their stories. Please contact the Community Care Access Point manager or team leaders on 1300 731 556 if you wish to clarify any business processes or have any queries about the assessments conducted.